Good morning, and thank you so much for joining us today. My name is Hayon. I am both the co-founder and president of Inspira Technologies. Inspira is really an amazing company with a lot of opportunity, and I'm sure you've been following us for quite a long time, seeing our progress and seeing how we're creating a momentum both from the technological and from the market perspective. Our goal is to empower breathing without lungs, special technologies that use blood oxygenation to provide life support, to sustain life, and to provide better technologies and better treatments in patients that would normally end up on life support and in many cases mechanical ventilation. So just going through. Inspira plans to revolutionize the $19 billion mechanical ventilation market. We aspire waves of change, waves of technology to improve the world of life support. Now, we're a very disruptive company. We plan to continue and push towards being a disruptive company. And we are very proud of what we've achieved to date. If we look past the last few months, we have submitted the Inspira Art 100 to the FDA for clearance. We have several distribution agreements, preconditions that have been signed. We have shown accuracy results around the breakthrough Hayon blood sensor designed to measure blood at real time without physically touching the blood. We've had patent approvals by the US office for our breakthrough vortex blood oxygenation technology. And we've also spoken about additional technologies that we plan to have patented in the near future. And of course, we've spoken about that key milestone, that milestone around blood oxygenation that we plan to share the primary results about, and we'll dig deep a little bit as we go along during this presentation. Unfortunately, we're living in a live world where there are 20 million people every single year that end up on mechanical ventilation. This is an unacceptable number, 20 million people, millions alone just in the US. These folks are brought into the emergency room, they end up in the ICU, they've got difficulty breathing. And the only solution that the medical world can offer in many cases is to place the patients in a coma, to place the patients, to have them intubated, to place them in this long journey while they take care of the underlying medical problem, while the doctors try repair whatever's gone wrong. And this, unfortunately, is a slippery slope. Now, we think about this. I mean, what are we really trying to achieve when it comes to mechanical ventilation? You see, our body, it's built up of billions of cells, and we need to get oxygen through our lungs and into our blood in order to feed the body, to support those organs and sustain life. When you're sick or you've had some terrible trauma, the only way to keep this going is by providing you assisted breathing. Well, at least in today's world, prior to Inspira Technologies. Patients are placed under heavy sedation. They have these tubes stuck down their throat. They have oxygen forced through their lungs in order to get that oxygen that provides life into the blood. Now, if they're lucky, they're home within a week, 2 weeks. But many aren't, because there's a high mortality rate. You see, patients will develop both infections because of bacteria penetrating the tubes. They will deal with muscle loss, pressure wounds, lung injury because the mechanical ventilator is being used in a way that it's applying too much pressure to the lungs. So at the end of the day, yes, there are complications, prolonged treatments, and death. Now, this is actually a picture of a family member. This is a picture of my father. My father has been on mechanical ventilator for a long time. It's when you see it from close up that you really understand how dreadful and how medieval this type of treatment is. You see, he fell and cracked his ribs. And you would think, okay, that wouldn't be much of a problem. Within a week or two, you'd be back on your feet. But it doesn't work that way. Because when you have such trauma to your body, you have to be placed often into a coma and be connected to a mechanical ventilator. Now, it's not as simple as it sounds, because while the person's being treated, they're being given lots of heavy sedative drugs. And this develops a state of delirium, which means after 2-3 weeks, the body has absorbed high quantities of painkillers and sedative drugs. So when they try to get the patient off, they can't do it. Because once you have delirium, it means that you're basically not with us. You're kind of like in a daze that you can't get out. You don't understand situations, and therefore you can't go and wean the patient off. Now, often when they still try and it fails, they'll move to the next step, inserting a tube into the patient's throat, just like my father. And now we're on a different level. You're getting sedated, they're trying to reduce the sedation, and you're getting weaned. And then the patient's kind of feeling a little better, and often patients are pulling out the tubes themselves. And so the only solution is that they actually tie up the patients as if we're in the medieval period. And that in itself creates post-traumatic stress. It requires additional sedatives, and it's a vicious circle. And while all this is happening, complications kick in. Infections, overinflation of the lungs. The heart may start to kick up. You may have thyroid infections, the kidneys. So at the end of the day, what should have ended up as a week or 2 weeks in hospital can end up as being months, years, and it can even be worse. We just don't leave the hospital. Now, Inspira plans to change this world. We plan to provide new technologies so that no one has to deal with these types of treatments anymore. Yes, we have respect. Mechanical ventilators have saved so many people. But what about those ones that haven't succeeded? What about the ones that haven't survived? What about their families, that trauma, the high costs of medical bills? Something needs to be changed, and we potentially have the solution. So what we're talking about is that opposed of going through the sick, damaged lungs to get oxygen into the blood, we're talking about a totally new approach, which means we're bypassing the lungs. In other words, we're going straight into the blood, bypassing the lungs, oxygenating the blood in a fashion that we can provide support to the body, to the organs, and it could happen potentially within minutes. You see, we're developing a unique technology, the Inspira Art, and we call this adaptive blood oxygenation. And this is a really very, very unique technology. It's designed to continuously measure the patient's blood status, their parameters at real time. Now, this doesn't require for a nurse or a doctor to go take blood tests. No, we have a Hayon blood sensor that is mounted on the tube, and the blood that's circulating from the patient to our machine is being monitored with the system clamped over the tube. So we can basically scan the blood, we can read the blood, we can identify what's happening in key parameters, and therefore understand what is the true medical condition of the patient. Now, while we're doing this, we're applying another proprietary technology, which is the Vortex, and you've heard about that pretty recently. And it's a unique blood oxygenation capability, which basically causes the blood and oxygen to bond together. And let me tell you something, it's almost magic. It's very close. It's breakthrough, it's almost science fiction. And this capability to identify the patient's blood parameters, to monitor them, and then go and oxygenate the blood in a way that would reduce negative elements on the blood, we can potentially provide an adaptive oxygenation process, meaning less oxygen, less blood, providing a much better and more effective, potentially, treatment to the patients. And the key thing is that we're doing this, and we plan to do this while the patient is awake. No coma, no sedation. Now, I do want to talk a little bit about the milestones that we spoke about. And yes, we've informed the market that we plan to talk about a key milestone. We plan in a couple of days to share primary results about blood oxygenation. So I can't go into too much detail, but what I can tell you is this is groundbreaking. We're talking about an ability which is moving or breaking through a technological barrier. It's the next level of blood oxygenation. And should we succeed and have the right results, this technology would potentially rewrite the blood circulation, the blood oxygenation market. It would reset the rules. It would prevent or potentially provide an alternative for all the medical device players that are in the sector to be able to blood oxygenation in a totally different method or in using a different procedure. Again, taking into consideration what I can share with you. It would also mean that all the medical device companies today would no longer be dependent on a single supplier which they rely on in providing the machines and resources or solutions that they have today. So this is really breaking through those technological barriers. This is really breakthrough should we succeed. And moreover, this could potentially reshape the medical landscape. This could potentially change the way we are circulating blood and oxygenating blood. And we're in a life or in a business of life support, of supporting organs. So potentially this new technology, the success of the primary results, the tests, could mean that we'd be able to expand into different applications, expanding potential solutions to the market. And I've got a hunch, but I guess that most of the medical device companies read our PRs very well. Now, should we succeed with the art, with the Inspira Art, and you've also heard about it as the Inspira Art 500, we will eventually reach the status of preventing the need for mechanical ventilation. Because if we can treat a patient while they're awake without sedation, we are pushing away so many complications that only further put the patient at risk. And as I mentioned, it would remove delirium, reduce hospital days. It means that oxygen will be going straight into the blood, as opposed to being pushed and forced through the lungs and causing lung injury or potential infections through the tubes in the throat. Now, our products, and especially the Inspira Art, is designed to be next generation. As we see the Generation 2 product, it's measuring blood parameters. Now, blood holds the secrets. It holds secrets about your medical status. It tells the doctors how you are feeling at a specific time, what's going wrong, or what's improved. So having this information at the tip of our fingers could be key when we talk about future patient treatment. So the Inspira Art Gen 2 will be equipped with these capabilities thanks to the Hyla. Now, we've told the market that we plan to submit the Hyla to the FDA towards the end of 2024. And once we have that cleared, we will make sure that this unique blood sensor be integrated with the Art 100, putting this system potentially on steroids. Now, measuring the blood means we could potentially perform early detection. It means we could provide doctors key information about patients' conditions, assist them with important decision making. Now, as I said, we plan to disrupt the medical market. The Art 100 has an opportunity and a market of around $1 billion. Now, we hope and we are expecting for this product, we anticipate for this product to reach FDA clearance in the first half of this year. As you know, it was submitted in 2023. And as you know, this product was revealed at one of the largest expos. And it's been gaining a lot of traction, a lot of interest. Doctors, hospitals who have reached out and signed certain agreements. We have distribution agreements for all our products. And these are just indications of the beginning. These are indications that even though we are still in development or FDA submission processes, the market understands and doctors understand that we could potentially have something different, something which is mind-blowing, something which is next generation. And these are pure indications. And we hope that in the close future, we will be able to share with you our movement as we move towards getting into different medical institutes. The Inspira Art, the second generation, the Gen 2, as we call it, it has amazing technologies, including the technology that I spoke about that is going to potentially blow things out of the water as the ability to oxygenate blood in a very, very unique way. These capabilities is what assists us to use blood oxygenation in a totally different way and to grow the market. Because today the market is limited to about a $1 billion market for bypass, for ECMO, for open heart surgery. These are the markets that we have today for blood circulation. But if we can oxygenate the blood differently, if we can monitor the blood during this procedure, if we can include additional or new technologies, we can potentially change the intent of use. We can use this type of technology on a much larger patient population. We would be able to use this technology potentially at a much earlier stage, which means the patient's experience could be totally different. You wouldn't potentially have to be sedated in a coma on your deathbed on a mechanical ventilator, but alternatively be sitting or lying in bed, awake, communicative with your doctors, with your family, being treated through blood oxygenation using new technologies while you're getting monitored by the higher blood sensor, and therefore your doctors know exactly or have a very much better indication what's happening to you as a patient. And that's the difference. And should we succeed? Yes, we plan to be in ICUs, we plan to deploy in hospitals, rural hospitals, small clinics. We would be able to potentially reach millions and millions in patients today that just end up on mechanical ventilators, with statistics showing that 50% of patients do not survive. Sure, it's because of the medical condition. Sure, it's also maybe because of complications, which are very, very common. But the bottom line, the results are not good, and we should not accept them anymore. So I would like to thank you very much for joining us today. I just want to keep two important points in focus. The company really, we appreciate your support. The management appreciates the support. We have a great company, a great team, great partners, and we see that we are going to continue to work hard for you to ensure that we are able to bring these products to market, even though we know it's going to be challenging and there are still milestones ahead. But the market needs these products, the public needs these products. What we have here, as I said, in just a couple of days, we will be releasing results once we analyze and review the data for a key blood oxygenation capability, something that I believe is breakthrough. It's breaking the technological barriers. It could, in a sense, rewrite certain rules of engagement when it comes to blood oxygenation. It would potentially equip us with a technology that can replace areas within the sector today, because, as I said, there are certain materials, certain procedures that can only be attained from one supplier. So all the medical device companies are now today dependent on one supplier, and hopefully we will shatter this concept and provide a new solution both for our products and for their products. And taking it further, it means that we could potentially expand. So we've spoken about our $1 billion market opportunity with the Art 100. We have the $19 million business opportunity with the Inspira Art. But you know what? That may not even be the most exciting part here. There could be more. And as a company that's pushing to break all the barriers, to go beyond, Inspira Technologies will continue to push and work towards new technologies and new solutions for a growing market need. Now, finally, I don't want to remind you, we do have the Art 100. It was submitted to the FDA for clearance. It takes a couple of months. There is a period. We've started this process already in September. So hopefully, if things go well, we anticipate to have clearance within the first half of 2024. So again, my name is Hayon. I am a co-founder and president. The success of Inspira is something we take very, very seriously. And I would really like to say thank you very much for taking the time to learn more and keep in touch. Thank you very much.